Hello and welcome to B'nai Abraham Chabad. Welcome to the Bright Side program. We're going to begin with the mitzvah of tzedakah. Join me if you have a pushka nearby. And our prayer today is from the book of Psalms, Psalm number 129. Shir Amalois, Rabas Traruni min Uroi Yoimar no Yisrael, Rabas Traruni min Uroi Gam lo Yachlu li, Al Gabi Chorshu Chorshim Ha'erichu Ma'nisam, Adinoi Tzadik Kitzeitz Avois Rishoim, Yevoishu v'Yisoigu Achar Kol Sonei Tzion, Yiu Kachatzir Gagoi Shakadma Sholaf Yavesh, Shalameile Chapoi Koitzer v'Chitzme Me'amer, the song of ascents. Much have they persecuted me from my youth on. Let Israel declare it now. Much have they persecuted me from my youth on, but they have not prevailed against me. The plowmen plowed upon my back. They wished to make their furrow long. But the Lord is just. He cut the cords of the lawless. They will be humiliated and will be turned back, all the haters of Zion. They will be as grass upon the rooftops that withers before one plucks it, wherewith the reaper has never filled his hand, nor the sheaf binder his arm, and of which the passers-by never have said, the blessing of the Lord be upon you. We bless you in the name of the Lord. Today's story takes us back to the 18th century, where Rabbi Yisrael Baal Shem Tov, the famous Hasidic master, the founder of the Hasidic movement, turned to one of his disciples, whose name was Rabbi Zev Kitzes, and he says to him, "You will blow the shofar for us on Rosh Hashanah." Now, blowing the shofar is not just a technical skill, but it also comes with a spiritual skill and the responsibility that the Baal Shem Tov had given his senior disciple, Rabbi Zev, was to study the Kabbalistic writings, the mystical teachings that are behind each and every note and sound of the shofar blasts. Each one can access a different level of reality and a deeper chamber of the soul. And when the shofar is sounded on that awesome day, on the day of judgment, on Rosh Hashanah, when the person blowing the shofar keeps in mind the kavanos, the intentions of what these shofar blasts are supposed to accomplish in heaven, it takes the experience of the mitzvah of blowing the shofar to a whole new level. So here he was, this disciple, Rabbi Zev, takes on this responsibility and spends a good couple of weeks immersed in these Kabbalistic texts. And finally, the great moment arrives in order to prepare him, in order for him to remember all that he had studied. Rabbi Zev had written down on a piece of paper some brief notes, so that as he's blowing the shofar, he would look at the paper and he would recall the deeper intentions that he's supposed to have in mind during this experience. And when the moment comes and the entire synagogue is filled, is packed to the capacity, the Baal Shem Tov is there, and all of the disciples, all of the students of the Baal Shem Tov are waiting. It's silent. It's time to listen to the shofar. And Rabbi Zev searches his pocket for that piece of paper that he had prepared, but it was nowhere to be found. It was gone. And suddenly, he didn't know what to do. He tried to recall the mystical meanings of the various notes of the shofar blasts, but his mind went blank. He was so frustrated at himself for not remembering to bring that note. Somehow he started weeping, and tears of frustration came overwhelming him. His heart was broken. How can I let down my master? How can I let down the holy Baal Shem Tov, who has given me this privilege and this responsibility on this day, on this holy day? And so, without having a choice, Rabbi Zev blows the shofar in a very simple manner, as if he's blowing a horn, not even being able to recall all of these deeper meanings behind the shofar. And he was so embarrassed at the end of the prayers, he couldn't bring himself to look at the eyes of his master and teacher, the Baal Shem Tov. But then the Baal Shem Tov comes over to him and says, "My dear student, that was a most extraordinary shofar sound, the most extraordinary that I've ever heard." And Rabbi Zev is shocked. Baal Shem Tov goes on to explain. And he says, in the king's palace, there are many gates and doors. Each one of those doors has a key to open the door. The palace keepers have rings with all of the keys that open every single chamber in the palace. But there's one key that opens all the doors, the master key. And he says, the Baal Shem Tov says, that all of the mystical intentions and meanings that you have studied are each meant to unlock another chamber in the soul, and in turn to unlock the doors in the heavenly gates, in the heavenly chambers. But there's one key that unlocks all the doors, the master key. And that key is the broken heart. The master key is a broken heart. And Rabbi Zev understood that it was his broken heart that allowed him to achieve the desired effect, the shofar sounds that his master, the Baal Shem Tov, was so excited about. Now, when we talk about prayer, heartfelt prayer, sincere prayer, and the power of our feelings and thoughts during prayer to break through the veils of divine judgment. Sometimes there's a blockage, and it takes that brokenness, not a sadness, but a broken heart, to be able to break through those barriers. That is certainly one method that is discussed in many stories and many teachings. However, the Baal Shem Tov did not stop at the gate of tears and of broken hearts. The Baal Shem Tov also taught us another teaching. And he said, if tears are what open up the heavenly gates, the feeling of joy completely demolishes them. So in fact, the Baal Shem Tov is teaching us that for a person to have joy, whatever you can accomplish with a broken heart can be even more powerful to influence the upper worlds at an auspicious time, when you're joyous, when you're able to create and cultivate a sense of positivity, a sense of optimism, and even a sense of joy, especially during difficult and challenging times. There was a chassid who was having a private meeting with the Rebbe, and he was talking in a very negative and pessimistic way. And the Rebbe stood up and took out a volume of the Zohar, the main Kabbalistic work. He takes it off the shelf and he reads to this chassid and he says, Tachaz, come and observe. Our world is always ready to receive the spiritual flow that emanates from above, says the Zohar. But the upper world provides in accordance with the state below. If the state below is joyous, then correspondingly abundance will flow from above. But if the state below is one of sadness, then the flow of blessings is constricted. And therefore the Rebbe concluded, serve God with joy, because human joy and optimism will draw a corresponding joy from above. So the idea behind this, the philosophy behind this, is that we have heaven and earth in constant communication. And what the Zohar is teaching us here is that what happens down here below actually impacts what happens above. The heavenly response to our circumstances is often shaped by our own mindset. And so when we pray to God, when we turn to God in prayer, we have to make sure that our hearts are filled not just with sorrow, but also with joy. And when we're able to cultivate that inner sense of joy, we connect with a very powerful concept, which in Hebrew is simcha poiretz geder. Joy breaks through all boundaries. All constrictions, all limitations can be torn down with the power of joy. So even when we are filled with sorrow, even when we are filled with a sense of brokenheartedness, we should remember that it should be permeated with an awareness of the deeper purpose, and that is to serve God with joy. Our guest today is Dr. Marina Katsnelson, who is an assistant professor of obstetrics and gynecology at the Hospital of the University of Pennsylvania. Welcome to the Bright Side program, Marina.
Thank you for having me.
Nice to have you with us. Start out by telling us a little bit about your work as a doctor. What do you do?
So I am a faculty member at the Hospital University of Pennsylvania. I see patients in our practice, that's faculty practice as part of the university, both for obstetrical care and for gynecologic issues, routine well-woman care. I also precept residents in the resident clinical setting, as well as deliver babies at the hospital, and teach medical students, midwifery students, nurse practitioner students, and perform gynecologic surgery.
Wow. Definitely sounds like a lot. I bet delivering babies is the most exciting part.
It is very exciting.
It brings happy moments to the hospital.
For sure.
So we've all been going through challenging times over the last couple of months with the pandemic, and each of us has been impacted in different ways. One of the things that we are realizing is just how important healthcare heroes like yourself are at the front lines. So we want to thank you for everything that you're doing to bring healing to the world, and preventive healing, teaching as well, all such essential areas of work. But how has the pandemic affected your practice?
So I'm fortunate in that I work with a group of very energetic and forward-thinking individuals. And it was really impressive to see how in the matter of a week, we went from one way of doing things, kind of business as usual, to revamping our entire way that we provide obstetrical care to our patients. We have scaled up in a crazy fast pace the idea of telemedicine and how to incorporate that into our obstetrical care model of today. How can we continue to provide safe care to our patients and at the same time minimize their exposure and minimize their contact with in-person contact with the healthcare system, while not jeopardizing quality care that we strive to provide. And we found that some aspects of this we already had put in place as sort of as just things that people had been working on for the past couple of years. And so we found ourselves sort of a little bit ahead of the game because we were starting to provide blood pressure cuffs to our patients to do some sort of remote monitoring to decrease the number of in-person visits. And so we were very well prepared, as it turned out, to kind of scale this up in a way that I think that we were very fortunate to be able to do quickly and effectively. Um, so that was really incredible to watch. And same thing with postpartum care, where we're able to take a pilot that had been planned kind of in the planning stages and very kind of like small scale stages for months, and be able to quickly scale it up and implement it through the really hard work of my colleagues to be able to get our babies and moms home sooner, and working with the pediatric team and working with the inpatient and outpatient teams to really try to um, get people where they're the safest, which is at home.
Wow, that's incredible. I'm uh, I'm guessing you haven't yet come up with a way to deliver babies remotely.
Unfortunately, no.
That's still done in person.
That's still an in-person job.
Yeah. Okay. So tell us a little bit about one of the themes that we've been discussing here on the bright side is the importance of thinking positively for the patient as well as the patient's caregivers to have a positive and optimistic mindset. Um, in your experience, is that something that is helpful for their healing?
Absolutely. When patients have a positive mindset, it definitely decreases some of the fear that and some of the anxiety that people can have. I mean, in particular, you know, kind of the peripartum time around the time of woman's delivery can be a very anxiety producing time, especially for women that perhaps are having their first baby. And as the pandemic was setting in, there was a lot of uncertainty that people were facing. The hospital policies were changing so rapidly. Patients really didn't know what to expect. They were facing a lot of anxiety from the fact that surrounding areas and neighboring states were implementing very stringent visitation practices for a while, and so we had to really try to be this constant and be this kind of steadfast, reassuring force, and help trying to kind of assume some of the roles that, previously we perhaps didn't have to fulfill, in terms of really just talking through some of the ways that people are going to plan things out, and, how to help people adapt to this rapid pace of change. How to get used to the idea that, hey, maybe your partner won't be there for your birth. I mean, hopefully they will be, but I can't really predict what's going to happen in 2 weeks. So, like, how can we prepare mentally for the possibility that you can do this if you needed to do this? Like, you can do this and we'll support you. And like, really try to implement some of this positive psychology into, like, well, let's think about how can we make this happen. But fortunately, we never came to that here in Philadelphia. We're very lucky that that I think the way that the response was implemented, that we were able to avoid having to restrict visitation. But these were conversations that for a couple of weeks there, we were having very routinely with patients as they were nearing term, and trying to really support them in a positive psychology kind of model to prepare for the uncertain, which I think can be really stressful.
Wow. So the doctor became the psychologist as well.
Psychologist, social worker,
All of the above.
simple things that people just like needed to talk through, like the logistics of how they were going to take care of their children at home while managing, and some, without the family supports that they're used to, like all of the plans that they had made with their in-laws and their little village, like all of
Right.
a sudden wasn't there. And so these were conversations that we were having, and trying to help people through this process, you know.
And for the most part, it sounds like you were successful.
I believe so.
That's good. That's great. What have you learned from going through this experience? We're looking for a bright side, something that we all are going through a very challenging time, something which we didn't plan for, something which we didn't expect in our wildest dreams. And we realize that there's got to be some hidden good. So I'm wondering if there's anything that you can share from your experience that would be a bright side for you.
Well, one of the bright sides for me has been to kind of watch my children bond and grow. I mean, this is the most time that I think they've spent with one another ever in their life, and just watching in the way that they've been supportive of each other, and kind of, I think, taking this very unusual situation in different ages and being able to play and interact and support each other through all of us being home, through me going back to work, on a more full-time basis once things started reopening, and just being really resilient, which I think has been really wonderful to see. Um, Also, really thankful for my coworkers. I already mentioned, like, have shown like great innovation and resilience, and like working with our resident staff. They had faced this really crazy, uncertain year, and they were really on the front lines. To me, like, I don't feel like I was necessarily on the front lines, but they really were, because they're sort of the first, our nurses, our residents, they're the first ones in the room before they really know very much anything about a patient coming in. And the positivity and the resilience that they showed through these past few months has really been inspiring to us all, honestly.
Beautiful, beautiful. So you've seen it at work and you've seen it at home with your family. The power and the resilience of the human spirit to overcome obstacles and challenges, and do so with positivity and optimism.
That's right.
Well, thank you for sharing your experience, Marina. It's been inspiring to hear, to listen, and God willing, all of the work that you're doing will be only for happy things, to bring babies into the world, and to do preventive measures in healing, and God willing, we'll see an end to the virus, to the pandemic very soon, and we'll be able to focus on only positive things.
Thank you.
Okay, appreciate your time. Thank you so much, and have a wonderful week.
Thank you, you too.
Thank you for joining us today on the Bright Side program. If you enjoyed this program, we ask that you consider even a small contribution to B'nai Abraham Chabad to help these programs continue. I want to thank our sponsors for making this possible, and wish you a wonderful week.